So we'll discuss all the diseases related mouth. First is mouth. Okay. Mouth disorder. Uh, tongue, tongue disorder, lips disorder, stomach disorder. Next we have intestine disorders. Next we have third number liver, pancreas, okay, spleen, and gallbladder, GB, etc. All disorders one by one we will discuss. So first start with disorder of mouth. Of mouth. In that, what are the things we will discuss? First is mouth ulcer. Mouth ulcer is most common. And second, we have next is in the mouth we have bad breath. Okay. Next we have sometimes itching in mouth. Okay. Sometimes taste disorders, saliva, drooling of saliva, taste. Gradually, taste is related to tongue, so we'll salivation or drooling from mouth. These are the three most common issues, or sometimes dryness of mouth. Dryness of mouth. So all these four disorders we'll discuss in disorder of mouth. So first one is ulcer in mouth or mouth ulcer. Mouth ulcer are very common. So basically, ulceration is it is a mucosal membrane. Basically, our mouth is covered with epithelial muscles, epithelial, muscular, or mucosal membrane. Okay. So basically, these mouth ulcer initially uh, small and sometimes painful or sometimes painless. Okay. Initially, when they are small, you have sometimes pain, sometimes painless, but they are small. Okay, small in color, small, and they are redness. Okay, and painful. Some people have very hard pain in uh, this ulcer. Okay, basically here lower lip. Okay, in this our side of the cheek. Okay, so basically it is not mostly non-cancerous. Okay, non-cancerous. Okay. So what? But it is difficult to eating food. It is difficult to taking water. Okay, and sometimes they are due to the viral infection. Sometimes bacterial infection. Sometimes due to the deficiency of vitamins. Okay, mostly vitamin B6 deficiency, which cause mouth ulcer. If it is non-healing, so you have to check whether it is cancer or not. So what you have to do, sometimes we do biopsy. Doctors do biopsy, take the part of the ulcer, and they will check that is there any cancer growth or not. Why is not healing? Non-healing mouth ulcer. Okay, non-healing mouth Mouth ulcer. Okay. Non-healing mouth ulcer. Sometimes it will last long for many days. So we will see the image. So you can see here what are the causes of mouth ulcer. Sometimes we're fighting of vitamin or energy, sometimes deficiency of vitamin D and vitamin B12 causes mouth ulcer, viral infection, sometimes digestion issues, hormonal changes, emotional imbalance, causing stress and anxiety, sleep deprivation, food allergy. These are the things which cause mouth ulcer. So you can see that this is the uh, lesion like structured redness is there, pain is there, tenderness is there. Okay, so you need to treat when uh, when it is in initial stage. So if it is not healing, you have to check with your doctor or any specialist doctor to identify whether it is not healing also or other than that, it may be due to the cancerous growth. This is you have to confirm. So what are the treatment? Okay. What are the treatment plan for mouth ulcer? So basically, you are getting basically you need to understand what are the remedies for digestive system. Okay. So what are the remedies? Basically, in the electrohomeopathy, S group is primarily designed to treat digestive system. S group designed, okay, S group, okay. Whole S group is for digestive system or you can say lymphatic system. Okay. Basically, you can see that all the organs which are present in the digestive system, primarily their function is according to the lymphatic system. So, in the main lymphatic system, it is according to okay, lymphatic temperament. Lymphatic temperament, main organs are the digestive system. So the digestive system disorders occur is mainly in lymphatic temperament patient. What we have to treat? We have to select within S group. S group is very important. In that we have S1 initial first remedy and S2 also works. Okay. S2 also works. S3 mostly S3 and sometimes S5 also work. And we have S10 also work. And we have S11. These are the acute remedies which work on digestive system, and we have C1, C3, C5, C10. All this work on digestive system. And other than that, we have L1 remedy and other supportive remedies are when one, where one. In electricities, mostly we use WE, G, and G, and RE also. And why all the electricity according to the condition must, but mostly we use W. Okay, RE, Y sometimes. So all these remedies will work on digestive system. So here we are talking about mouth ulcer. So see, whenever a disease you are treating, you have to think two things. You have to think about two things. One is anatomically and physiologically primary thing. Second thing is the environment of the patient. And with the diagnosis, which internal organ is affected. Okay. So here we got number of reasons are there. Okay. So vitamin D or B12 deficiency, you need to take the vitamin in the diet and according to the medicine also. With the infection, digestive issues, hormonal issues, all this we have to ask the patient. Will get the right answer. Okay. So you want to treat the mouth ulcer. So basically, initially you have to treat anatomically and physiologically, and secondly, according to the temperament, which internal organ is affected. So here, if you see the mouth, mouth have epithelial layer, mucus epithelial layer are there. Okay, always you have getting saliva in the mouth. Okay. So here the mouth is made up of epithelial layer. So here directly S3 will anatomically or functionally or secretion and structurally, like C3, which is C3, and there is the redness. Means in that area you have what you have? You have an issue. There is an abnormal substance which is present in the brain. So with structurally, you are giving nutrition to that area, mucus area, and uh, functionally, you are giving the nutrition area, and structurally, you are draining the waste substance. So with S3, you have to add A3. Okay. With C3, you have to add A2. Okay. A3 will give nutrition to the area. A2 will release the waste materials from the area. Which electricity you have to select? You have to select because there is the burning sensation, redness is there, pain is there. So you have to use P. And here you have to add because there is waste material and pus formation will be occur in coming days. Okay, so you need to give G. S3, A3, PE, C2, A2, G. But if it is viral infection, cells of the epithelium is affected, and you have to decrease the bacterial infection anatomically and structurally and pathologically also. Now you are getting into that place. Cell is affected. C group you need to take. An infection is there. You need to take out the infection. So one you have to take, and you have to reduce the infection load. You need negative electricity. So here combination C1, Ver1 and Y1. We can give to the patient with ointment also to apply that area internally also. So these are the three remedies you are making to the mouth ulcer treatment. Okay. So what you understood about with any digestive issues, the other issues are there. So we'll treat according to that initially, anatomically, structurally, pathologically, we are adding the remedies. Simple. Okay. If other problems are there, indigestion is there. So we will talk about indigestion. You have to give that treatment. If there is liver issues, you have to treat. You have to give liver problem issues treatment there. If you have vitamin deficiency, means small intestine not absorbing the food, means absorption problem is there. So you need to treat small intestine. Likewise, you have to go in deep and into the patient if you want to give permanent. Okay, so this is all about today's class. We will talk about mouth ulcer, other topics tomorrow. Okay, so any doubt? Yes.